Hi everybody, today I'm going to share with you my dental hygiene routine. I am Taylor McFarland, a board certified pediatric dentist and mom of 3, and I myself have struggled with toothbrushing at times during certain periods of my life that were really tumultuous. So the pandemic, being home with young kids, I was pregnant at that time, and then postpartum after having my 3rd. Oral hygiene sometimes for a lot of people, especially when you're struggling with something like anxiety, ADHD, or depression, can be a really challenging task. So if that's you and you're in that season and you're like, maybe if I see what the dentist does, it's gonna help me. I hope what helps you most of all from watching this video is just hearing me say that it is normal, it is not uncommon, you are not gross if you struggle with oral hygiene tasks. So let's go through my nighttime routine here now. So when you are thinking about your routine, you want to think about the different parts of your mouth. You're cleaning, right? Most of us, main thing is we're cleaning the teeth. So toothbrush, toothpaste to clean in between the teeth, floss of some kind, string floss picks, or a proxy brush. Then your tongue, you want your tongue to be cleaned off of any odorous bacteria that are building up there, or even dead skin cells. A lot of people have what's called a coated tongue, especially if you smoke or vape. Anything that's harming those skin cells a little, causing them to turn over faster, like from heat. Really strong coffee, hot coffee that you're drinking can do that too. You'll get like a white color on the top of your tongue in the center, and so you want to be tongue scraping as well, cleaning your tongue. But those are the 3 things. So your gums, your tongue, and your teeth. How are you cleaning all those things every day? So for my toothbrush, I use an Oral-B i09. I am not sponsored by them. I have the Sonicare too. I think it's under my sink. It is, I don't have the brush head because I don't like it. I just don't like it. Sonicare, I really like the pros about Sonicare, and I have a whole video I can link about electric toothbrushes and what I like and why. But Sonicare, the one pro is that it's a lot cleaner of a brush head. So this is their brush head. In terms of like buildup inside, they don't have little holes and stuff. You get gunk. That's the one thing I don't like about Oral-B is it'll build up gunk inside here and it'll like come out the back, even if you're really diligent about washing it out and stuff after every time you brush. The IO higher series, so like 6 and up, tends to be what I recommend depending on your price point. IO 6 is like the $100-ish range. If you want to spend only about $50, you can get the kids Oral-B toothbrush that's like age 6 plus. That one has good strength. I like the rotation oscillation and the small head size of this. That's why I use it. I just think it gets it really clean. But the higher up 6 and up ones, and especially this IO9, they're using not just rotation oscillation, but like micro vibrations. So it's similar effect. You're getting that pulsation of water as a Sonicare toothbrush. My teeth just feel cleaner with this one. Also my kids, I just switched my oldest. They were all using Sonicare kids toothbrushes, and I was finding plaque still left over on my son, my eldest. And so I just switched to an Oral-B, and his teeth are much cleaner. So that's just personally what I like. I think it's just, especially for kids, a smaller brush head instead of that long rectangle makes it way easier to access and clean tooth by tooth, because we all know that toothbrushing with an electric brush has the right number of movements, so 30,000 or more movements per minute. I'm also flossing my teeth. I hate string floss, and that's what I'll say about floss. String floss is a method, a floss pick is a method, and then let me show you a proxy brush. And these are proxy brushes. You can have a straight one or one that's like bent. That makes it a little easier to access the back teeth. You're probably familiar with these, right, from like cleaning between braces if you ever had braces. And so they would clean like around the bracket. You can actually use these perpendicular to your teeth to clean in between the teeth, because that's the spot that we're cleaning with floss. So where we're cleaning in between the teeth is the triangle of space between the teeth. That's called the papilla, the gingival papilla, the gum papilla. And you can't clean in between that space with your toothbrush. You can't reach in there. And so what your floss needs to do is it's going in between, and then you're scrubbing it along either side of the tooth. You're scrubbing it up in here and then down in there. So you see how it's cleaning. And you can do that with string floss or with a proxy brush. It scrubs in between. It cleans that same little triangle of space just underneath that contact point of the teeth. So these can be really great tools for people that just don't have the dexterity or the patience or never learned how to use string floss. String floss, especially unwaxed woven floss, is the ideal. So cocoa floss is one of those that's really great. But people like me, if you had braces in the 2000s and they squished your teeth so tight together, that woven floss that's unwaxed feels miserable. It's so uncomfortable. And string floss, just using it all is messy and kind of unmanageable. Most people don't do it. So even as a dentist, I use dental tape, so a thin waxed version of floss. Is it going to scrub perfectly every little bit of plaque away? Probably not as well. I also use these proxy brushes because I have a bonded retainer up top, and so I can use that to clean underneath there and not have to thread the weird little floss thing. The key with plaque, whether you're cleaning it away with your toothbrush or with these floss tools, is to disrupt it. You don't want plaque to sit there, to get hardened from your saliva and turn into tartar where you can't clean it off. The dentist has to clean that off. So I'll show you tongue scraping. So this is the metal tongue scraper that I like and use. I'm going to maybe from the side. You scrape as far back as you can tolerate without gagging, and scrape forward and clean. That's so gross. And the best time to brush is before bed. Don't eat anything else afterward. Don't rinse with anything else afterward for at least 30 minutes. So I floss, and then I am doing, so I'll show you the Proxa brush on myself, how it's kind of going in between underneath my retainer. So do that. And if you're doing the floss pick, you're going just down in that triangle space. And you try not to pop it down. You're trying to gently saw it between the contact and then slide it up on either side. Saw, and down. And then spitting out any blood or whatever. And just know, bleeding gums is not a bad thing. It doesn't mean you're doing something wrong. It just means there's an area where plaque has built up or some inflammation. It's just like when you get a cut and it gets kind of red and inflamed. There's some bacteria around. It's just irritated and inflamed. And you just need to clean that area a little bit more. Focus on it. Be sure you're flossing it. You don't have to be harder. You don't have to do it more vigorously. Just to focus on the area for about 2 weeks. Bleeding is just your gum's way of talking to you. That's how they communicate. So then with brushing, I am going to brush tooth by tooth. I'd say about 5 seconds per tooth. A lot of these newer ones have little buzzers and even apps you can follow to be sure you're brushing every surface and for the right amount of time. So you're brushing the fronts and the biting surface and the backs. And this is what it looks like for the fronts. I'll just show you a little bit. It's slow, like tooth by tooth. You can see I'm kind of angling it up to get it pointing under the gums because you have loose gum tissue, about 1 millimeter to 3 millimeters in health, at that edge of your tooth right here. And that sonic pressure of the water is helping to clean out that little pocket, that little ridge of gum that's loose too. So like this, you're angling it and holding it and giving it time to work. So don't do this with your electric toothbrush. If you have a manual toothbrush, yes, gentle circular motions. That's it really. Oh, I didn't tell you the toothpaste I use. So right now I am just loving Carefree. I do work for them as an affiliate. They were founded by a dentist in 2004, so they've got a long history in oral care products. The cool thing about Carefree is they are US based and they have both nanohydroxyapatite. Every other nanohydroxyapatite toothpaste out there, it's all the super crunchy, toxic chemical type land, and they haven't been around as long, and they're using fear-based marketing about fluoride to get you to buy their nanohydroxyapatite paste. Hydroxyapatite is what's naturally in your tooth, so getting the nano, the synthetic, the smaller version nanohydroxyapatite, that will help remineralize potentially more deeply, help with sensitivity. But what fluoride does, why I love it, it is safe in recommended doses. You're using just a pea-size amount on your toothbrush. It is going to help strengthen your enamel and prevent future acid breakdown, much more so than just hydroxyapatite alone. When you have fluoride on board, you get fluorapatite crystals that incorporate into your teeth. That dissolves at a whole order of magnitude more acidic at 4.5. Carefree has that. They've got grape, citrus, and mint. I'll put a link down below. You can get 10% off your order. It does contain SLS, so some people are sensitive to SLS. They get frequent ulcers. They feel like toothpaste burns or stings. If you want an SLS-free one, I talk in the Best Kids toothpaste one about lots of fun kid flavors. There's one called Dr. Bob that's flavor-free, so it doesn't even have a flavor, but there's no foaming agent, no SLS in that. Hello is another brand that still has fluoride, but it doesn't have SLS, and you can find it usually in Target, also on Amazon. So if you're looking for a fun toothpaste, Carefree is a great one that has 2 really high-tech ingredients. If you want just run-of-the-mill, regular old toothpaste, anything's gonna do that has fluoride, whatever flavor you like. If you want SLS-free, go with Hello. That's easy to find and relatively inexpensive. In the morning, sometimes I'll use a different toothpaste. There's a toothpaste called Tartar End that for a while I was getting a lot of buildup on my retainer. So if you struggle with tartar buildup, and this is a newer toothpaste, I talked to the chemist, the guy who invented it. This isn't ADA endorsed. I'm not an affiliate of this, anything like that, but it can help with tartar buildup. It has ingredients that help break down bonds between tartar in itself and tartar in the tooth. So if you struggle with tartar buildup, this is something that he developed because he struggled with periodontal disease, and his dentist, and then they've shared it now with many other dentists, really like this toothpaste. The downside is it does not have fluoride. I hope that helps. That's kind of my routine. I tongue scrape, I floss, I brush with the Carefree fluoride toothpaste. I don't scrub with my toothbrush. I spit, I don't rinse. I go to bed. If you guys got any questions, let me know. If there's anything I didn't talk about, like mouthwash, I'll make another video on mouthwash in particular. And if this was helpful, be sure to hit that subscribe, maybe even the join button. I am planning to go live every week, probably in the evening time to start with, and I just answer questions, talk to you guys, get to know you and your dental health questions, and that helps me guide my future content. And next up, YouTube's gonna show you the video they think would be most helpful for you. Thanks for being here. Appreciate you.